Hi guys, welcome back to the channel after the long weekend. Hope you had a great weekend. So we have finished last week about cancer. We have dealt about the structure of cancer, how cancer cell work, and then we have dealt about various treatment, surgery, radiotherapy principles, chemotherapy principle, terminally ill cancer patient and all. So we have we have completed the brief info about the cancer. So that we shall start with oral squamous cell carcinoma of different region. Okay, chalo, let's start today's class. So firstly we'll be starting with mucosal squamous cell carcinoma. So first is all about examination. हमारा आधा काम इधर ही हो जाता है एग्जामिनेशन पे. ओके, तो द ओरल कैविटी, neck and pharynx should be thoroughly examined. This include palpation of neck and oral masses and a visual examination of all tissue after all removable appliance have been removed. तो हमारा ओरल कैविटी, नेक और फैरिंग्स का एग्जामिनेशन होना चाहिए थोरली. उसमें नेक पैल्पेशन होना चाहिए, ओरल मासेस इवैल्यूएट होना चाहिए और विजुअल एग्जामिनेशन ऑफ और ओरल टिश्यू. और अगर रिमूवल अप्लायंसेस पहने हुए हैं पेशेंट तो उसको हटा के वी शुड एग्जामिन प्रॉपरली for better and overall visualization. Okay. Second is panoramic radiograph should be taken and the dentition is examined. Should also include a visual inspection of the pharynx and air passes, that is by mirror exam, which is indirect laryngoscopy, or a fiber-optic exam, that is nasopharyngoscopy. या तो indirect laryngoscopy करेंगे या तो nasopharyngoscopy करेंगे for the inspection of the pharynx and air passage. Now, after examination, second thing is staging. The biopsy itself and potential wound scarring or infection may distort the lesion and confuse later staging. Biopsy or wound scarring or infection can distort the lesion and they can confuse the later staging. A biopsy may also include inflammation within the regional lymph nodes, which would be included in staging and thus falsely stage the neck. तो कोई biopsy inflammation भी include कर लेता है जिसकी वजह से falsely stage कर देते हैं हम लोग neck को. So to note the size, that is T, the visible lesion is crudely measured in centimeters with a ruler. The greatest dimension of the lesion is recorded. Clearly visible boundaries are used. So, the greatest dimension of the lesion is recorded and clearly visible boundaries are used when we note the size, that is T. TNM staging ka T. Now coming to N. The appreciation of palpable nodes, that is N, is by the clinical feel and a rough ruler examination or estimation of size. Classification is strictly clinical. The scientific basis for advancing the end staging to N2 when a node exceeds 3 cm is the understanding that clinically palpable nodes that are greater than 3 cm are usually 2 or more nodes fused by tumor growing out of the capsule of each node. तो ये कह रहे हैं कि जो हम end staging को N2 दे रहे हैं is a node. N2 is when it exceeds 3 cm. So the understanding is that the clinically palpable nodes that are greater than 3 cm are usually 2 or more nodes जो कि fuse हो गए क्योंकि ट्यूमर अपने कैप्सूल से बाहर निकल गए ईच नोड के. Okay, that's all for today's class. We'll be continuing this in the next class. Till then, like, share, subscribe, and comment. Bye.